Okay, so we are moving on to exercise and sleep. So just like nutrition, physical activity itself, again, can have a massive impact and help influence the quality of your sleep. So an appropriate quantity of exercise will help you get sufficient rest and help resolve sleep-related issues. However, according to recent studies, insufficient or poor quality sleep may also result in less physical activity in the day as well. And it seems that optimising your exercise routine will optimise your sleep. They go hand in hand. And, there's other benefits, obvious benefits of exercising. And these are endless. It decreases risk of premature all-cause mortality, strengthens our bones, helps lower blood pressure, lower heart rate, improves our mood, lower risk of obesity, diabetes, and cancer. On top of all of that, it might actually help cure some mental health conditions such as, anxiety. And moderate to vigorous physical exercise can help reduce sleep onset, which represents time it takes us to fall asleep as well. And it can also decrease the feeling of being tired during the day, believe it or not. There's a survey that had been done in 2003 that showed that people who exercised less than once per week were more likely to have diagnosed or be diagnosed with sleep problems such as anxiety or just restless leg syndrome. On average, they slept less than 6 hours per night and had fair or poor sleep quality and had trouble actually falling asleep. So yeah, like exercise can have a indirect positive impact on your sleep quality, and since obstructive sleep apnea, or otherwise known as OSA, is commonly seen in people who are overweight. And since exercise helps you lose weight, it's safe to say that exercise is a good way of tackling or improving even your sleep itself. Aerobic exercise has also been shown to decrease in symptoms of OSA, and even if you don't lose any weight, the exercise itself helps. Although common sense would tell you that exercising before going to bed is obviously not a good idea. A lot of studies saw no effect on sleep quality or quantity when, for example, people that joined in the study exercise a few hours before going to sleep. There wasn't any improvement there in sleep quality. But it's important to note that most of the subjects within the study exercised more than 1 hour before bedtime, which could be a significant factor. Obviously, I wouldn't recommend exercising that close to your sleep routine. Ideally, to be honest, if you could do it midday, that's ideal. And yeah, you've heard me talk about this before. We want to be aiming for 150 minutes of moderate or even 75 minutes of vigorous aerobic activity, and 2 days, if we can aim for 2 days of muscle strength training per week. You can break you can break the 150 down into multiple sessions. For example, you could do 5 days of 30 minutes, and you'll get even more health benefits if you go past 150 a week of moderate intensity, or 75 of the little bit more of a higher intensity activity. But it's about sustainability. Remember that it's what you can manage in your week. So try and find a place to regular exercise in your schedule. To be honest, for like busy professionals or mum and dads, I seriously recommend investing in some home gym equipment. Obviously, this is going to be part of your program anyway. If you can go to a large gym, I think it's good as well the odd time, because you're going to have the social factor. But for pure consistency, I think it's important to keep at the home workouts for sure. So hopefully this was helpful. Quite a lot of common sense things there, and probably a lot that you know of, but it's just good just to do a little recap on that.